As it stands, there will be a nurses' strike in less than a week's time, the second strike in the 100-year history of the INMO. The government has stuck to the line that to accept their pay claim would break the public sector pay agreement. This agreement has been broken already as far as nursing is concerned. When I talk about nursing as well, I'm very cognizant of the fact that nurses are supported by a really valuable team of care workers, and the care workers also have to be recognised in all of this, and the hugely valuable service that they do within all of our health institutions. As it stands, the government employs up to 1,000 agency nurses per day, with many of those paid up to 20% more than HSE nurses. TD salaries were increased in the last budget, rising to over $98,000 per year. The agreement was to end the two-tier pay scale, which affects 10,000 nurses. The problems with conditions at work and retention will not be addressed by refusing to engage with the nurses themselves. We all saw the photo of the young nurses on the steps of the Sydney Opera House. They asked the government very simply, give us a reason to come home. And that is another issue where nurses do return back to this country and their qualifications and their experience is not recognised. It's not recognised within the systems. So they end up starting again on a very much lower scale than they have worked in for many years. I'm also deeply concerned that even more elective procedures and surgeries have to be postponed. The healthcare system that we have at the moment is not acceptable, and citizens continue to die prematurely because of the failure of this state to provide timely diagnosis and treatment, and that is a fact. It's an absolute fact. Citizens are dying prematurely, and it's wrong. So I want to ask the Minister for Finance to come into the House and at the very least explain to why the government will not even engage with the nursing unions. We all accept that pay claims and industrial disputes will happen, but the public have an expectation that the government will do their best through negotiation and mediation to ensure that vital services are not impacted on. So again, I call on the government to engage with the nurses, to provide the dynamic to effect positive change and make a career in nursing attractive to current and future nurses, and ensure that nurses and that other healthcare staff are working within institutions and within an environment that is safe, not the high-risk environment that they are forced to work in every day.